Let's now discuss stomach and small intestine 6, or the support the agent point, as part of our continuing studies on the Xi-Cleft or accumulation points. SI6 is located in the depression radial and proximal to the styloid process of the ulna, which forms when the hand is turned from a pronated to a supinated position. So how to find this point? This point is best located with the elbow slightly flexed. So we place the palpating finger on the distal position of the styloid process, and then when turning the hand from a pronated to a supinated position, we may use the mnemonic cat bread and eat soup to better recall this movement. So the palpating finger will glide into a bony cleft at the proximal aspect of the styloid process, which is the tendon of the extensor carpi ulnari muscle, which runs along this groove. This cleft also becomes palpable when the patient rests the hand on the chest in a half supinated position. We can locate SI6 on this bony groove. Okay. Needling SI6 can be done with a vertical or slight oblique insertion, 0.3 to 0.8 tune deep, in a proximal direction towards pericardium 6 or along the tendon towards the elbow joint. The actions and indications of SI6 are: it opens the channel, alleviates pain, benefits the shoulder and arm, and alleviates acute conditions. SI6 also benefits the eyes. As its special feature, SI6 is the Xi-Cleft point of the small intestine channel. It is an important distal point for pain and limited range of motion in the occiput and shoulders. For example, acute torticollis, and the lumbar region, for example, acute sciatica. For acute and painful impairment of motion, we use strong reducing needling technique while the patient gently moves the affected region. Here are illustrations of how to locate SI6 in a pronated and half supinated positions. Okay. As an accumulation point, SI6 is used for any channel problems of the small intestine, particularly acute cases with tightness of the sinews causing stiff neck and shoulders. Its effect on the feet is due to its relationship with the bladder channel within the greater yang. SI6 also benefits the eyesight, but only in patterns related to heart or small intestine. So in summary of its functions, SI6 brightens the eyes in blurred vision or eye pain. It also benefits the sinews. It removes obstruction from the channels in severe shoulder pain, severe pain of the upper arm, redness and swelling of the elbow, contracture of sinews, and in painful obstruction syndrome or the B syndrome of the feet. SI6 is the Xi-Cleft point of the small intestine channel. The Xi-Cleft points are where the Qi and blood, which flows relatively superficially along the channels from the jingle points, gather and plunge more deeply. The Xi-Cleft points in general are indicated in the treatment of acute conditions and pain. SI6 is particularly used for pain of the shoulder, scapula, and arm that is so severe that it feels as they are broken or dislocated. This action extends to its paired Taiyang foot or bladder channel, and thus SI6 is also used as a distal point for acute sprain of the lumbar region and for contraction of the sinews and painful obstruction of the foot. The small intestine primary and sinew channels connect with the outer canthus, and the primary channel also connects with the inner canthus. SI6 is renowned for its use in deficiency type I disorders, characterized by blurring and dimness of vision. In most authorities explain the name of this point, support the aged in the light of this action. So we use SI6 in combination with other points. For example, for pain of the shoulders, as if it were broken, we combine SI6 with bladder 10. For pain of the lumbar region and knee, we combine SI6 with GB30, GB34, bladder 60, and bladder 62. For blurring of vision, we combine SI6 with bladder 10. And for dimness of vision, we combine SI6 with LI4 and bladder 4. Thank you for your attention.